Thank you. We continue to make progress in reducing the average number of daily new cases of COVID-19, though our numbers remain elevated. The 7-day average number of daily cases peaked on January 8th with more than 15,000 cases, and now has dropped by 90% to 1,600 a day. Since this number is average cases by episode date, meaning the date a person was tested or began having symptoms, it does not necessarily match the number of cases we report each day in our press release, which is daily reported cases that could have happened days or in some cases more than a week before they are reported to us. I want to thank everyone for making this decline in cases possible. This wasn't a miracle, and this significant drop in our case numbers reflects actions and choices taken by millions of residents, workers, and employers. We should continue to see, should we continue to see less cases, we can move forward in our recovery as lower case rates allow for other sector reopenings. Last week, the decline in the daily case rate allowed schools the option of reopening for in-class instruction for students in grades TK through 6. When the case rate drops to 7 new cases per 100,000, schools will have the option of allowing in-class instruction for students in grades 7 through 12. Next slide, please. There's been a lot in the news recently about variants of interest and variants of concern. Public Health and USC currently are investigating a cluster of 4 cases of COVID-19 at USC. Of the cases being investigated, 2 patients are confirmed to have the UK variant B117, and 2 are suspected as variant cases, still awaiting laboratory confirmation. All cases were detected as part of USC's routine testing and surveillance program. These individuals are doing well and they're in isolation. Their close contacts have been identified, notified, and are quarantining. Scientific research suggests that the currently available COVID-19 vaccines are effective against the UK variant. But with vaccine supplies still limited, the local transmission of the potentially more infectious UK variant underscores the need for Los Angeles County residents to continue to use every tool we have to prevent transmission, including not gathering with people you do not live with, and distancing and masking when you are out of your home and around others. There are now 18 confirmed cases of the UK variant in LA County. To date, we have not yet found any cases with the South African variant in LA County. A news story this week mentioned that researchers at UC San Francisco identified a California variant that is widely circulating and believed to be more infectious and virulent. While we have not seen any of their research documents, we can confirm that between 40 and 50% of samples sequenced in our public health lab since December contain the L452R mutation of interest. Next slide, please. As we vaccinate our residents who are 65 and older, we have been noting a very similar and frightening pattern of inequity. As you can see on this table, white and Asian residents 65 and older continue to have the highest vaccination rate. As of February 20th, almost 48% of white residents and almost 45% of Asian residents 65 and older have received at least 1 dose of the vaccine. 38% of American Indian Alaska Native residents and 34% of Latin residents and 29% of Black residents who are age 65 and older have received at least 1 dose. And while these inequities are stark and unfair, When we look at the relative percent change from the week of February 9th to the week of February 20th, we see that we are making some progress improving vaccination rates in the hardest hit communities. The vaccination rate for Black residents saw the largest increase at almost 45%. For American Indian, Alaska Native residents, the vaccine rate increased 37.1%, and Latinx residents' vaccine rate increased by 31.9%, while the vaccine rate for white residents increased by 25.1%, and for Asian residents increased by 21.9%. Right now, the gaps in these rates represent inequitable access to vaccines. The shortage of supply has made appointments scarce and difficult to obtain, especially for people who may not have the time or technology to register. Improving access to areas of the county that have been hard hit is our priority. And these tend to be in areas where many Black and Latinx residents live. We have opened additional sites in these areas and are working with community groups who are assisting with registering people in these communities for vaccination. We're happy to see these early increases in vaccination rates as they indicate that our strategies may be working. And we thank our partners for their help and support as we continue to ensure easy access to vaccines in those communities that have borne the brunt of this pandemic. Next slide, please. Beginning on March 1st, eligibility for vaccinations in LA County opens up for food and agriculture workers, law enforcement and emergency responders, and education and childcare workers who live in LA County. All eligible workers will be able to sign up for appointments starting next week at the dozens and dozens of community vaccine providers, including pharmacies, health clinics, and City of LA vaccination sites listed on vaccinatelacounty.com and vacunatelosangeles.com. Healthcare workers and residents 65 and older remain eligible for vaccines and can continue to find appointments on vaccinatelacounty.com and vacunatelosangeles.com. Next slide, please. An estimated 470,000 people work in the food and agriculture sector here in Los Angeles County. For this sector, because it includes such a variety of occupations, one-size-fits-all approach will not be adequate. There are a number of food services and agriculture workers who may not be easily reached. Therefore, it will be necessary to not only partner with employers and employee organizations, but it will also require coordination with trusted sources for these groups like unions, workplace leaders, community leaders, and community-based organizations. Next slide, please. We estimate that about 691,000 people will be eligible for a vaccine in the education and childcare sector. Many school districts have partnerships and capacity to create their own pods to vaccinate their workforce. Independent and parochial schools will be partnering either with their school districts or will have reserved appointments at county pods for their workforce. There will also be opportunities for childcare workers to be vaccinated at closed pods and with reserved appointments at the county pods. Next slide, please. For the emergency services and first responder sectors, agencies, including the courts and correctional facilities, we will be partnering with fire departments, police departments, the Department of Public Health, the Department of Health Services, and local hospitals to vaccinate their workforce. We estimate that over 145,000 people work in this sector. That's it for my slides. In closing, I want to acknowledge the remarkable work that is being done by our many partners to vaccinate people who are currently eligible. There are so many people working on this effort, from the vaccinators at the over 400 vaccination sites who every day are providing vaccines to thousands of people, to our many partners who are continually innovating to create ways for people who are living in the hardest hit areas to have access to the vaccine. There is no shortage of heroes here in LA County, and I could not be more grateful for all of this amazing work.